But up next, we'll explain how your dentist could one day save your life with one simple exam. We'll break it down when we come back. The Chicago Dental Society is holding its winter meetings here in Chicago, and they have some important information, new information about oral cancer that we all need to know about.
Chicago dentist and Chicago Dental Society board member Dr. Sam Weisz is here to talk about it. Doctor, good to see you.
Good to see you. Thank you so much.
Yeah. So we were just discussing before we came on the oral cancer and your dentist connection, and I imagine a lot of people aren't even aware when they go and visit the dentist they're being screened for such a thing.
You're right. Every time that you're coming for your regular checkup, they're going to check your tongue and your cheeks and the roof of your mouth, and you're being checked without probably even knowing.
So what are the numbers out there? How common is this? How serious of a problem is this, of course?
It's really staggering. There's about 42,000 new cases just in America each year that are going to be newly diagnosed, and one person every hour is actually dying from oral cancer.
I think immediately what I think of when I think of oral cancer is people who have smoked for a long time are most susceptible, but that isn't necessarily accurate, right?
No, the face of oral cancer is really actually changing from these smokers and drinkers into this new population where they're linking it to HPV or human papillomavirus.
Wow. And let's talk about this. And while you talk about the face of it changing, I wouldn't think about a dentist checking you for oral cancer. I would think that your internist would. So talk to us about what happens when you walk into the dentist's office and he's checking you or she's checking you.
Sure. So we're in the oral cavity your whole visit, and so we're actually looking as you're going, but the idea is that we're going to pull your tongue to each side. You're going to look at the roof of your mouth and in the back of your throat and make sure that there's no lesions that are present. That's why it's so important that you're coming regularly.
And we're getting a good look at that right now. And you have a new device with you that is being utilized these days that seems to be pretty effective, right?
Yeah, so there's a lot of new technologies, and most of them are based off of light. And the one that we have here is no different. They're using a blue light technology that fluoresces into the mouth, and we're able to see different contrast.
So this is the device that you have in your hand that we were just looking at the video that kind of shows that blue light?
I turn it on, but it'd blind you, I think.
Yeah, we don't want you to turn that on. And we would, as a patient, we would not feel anything, wouldn't notice anything, but you would just...
Yeah, it's totally innocuous. It's just a blue light that's fluorescing, so you won't feel anything. You won't. It's not anything that you would even know. It's really not scary at all.
All right. And while we have you, very quickly, any sort of new developments in general in the world of dentistry you'll be talking about this week here in Chicago?
Sure. The midwinter meeting in Chicago is huge. Everyone internationally comes and converges, all the dentists, and there's a lot of new technologies. The biggest thing, I'm an author of a children's book about prevention. So,
good.
So the prevention's huge, and there's a new scientific study that the ADA came out with where we're changing fluoride. And fluoride is now going to be done at 6 months of age when their first teeth come in. So what we want to do is put a little smear layer of toothpaste even at the earliest age when their first teeth come in. And that's a change from 2 and 3 years where we were doing it before, where they're starting with toothpaste.
All right, Sam. Now, you know, a number of women are at home. They're going to be thinking, where's that convention going on with a lot of dentists and doctors in town?
Yeah.
Thank you so much for joining us this afternoon. We appreciate it.
Thanks, Doc.